Okay, so our last bit we're going to do are some of the ligaments and the tendons of the knee. So the first one's going to be our quadriceps tendon. Some textbook call it quadriceps ligament. I don't think it really makes a difference, but it's basically where the muscle bellies of the quadratus femoris are coming in and inserting into our superior pole of the patella. So that's going to be our quadriceps tendon. Then we also have the patella. We have to connect the patella to the tibial tuberosity somehow. So we have the patellar tendon. You guys probably remember this one. Anytime you go to a doctor, they love the patellar tendon tap reflex. So they'll whack that with the reflex hammer and we'll be good to go. Now our collateral ligaments, collateral being on either side of the knee, we're actually going to have the medial collateral and the lateral collateral ligament. So to do the medial collateral ligament, we're actually put them in a figure 4. There we go. And this is not an MCL. We do not have an MCL in this class. We have a medial collateral ligament. It runs basically from the medial femoral condyle down to the tibial condyle. So we're right in here. So for our purposes, it's going to be right about there. And you can actually feel, so the ligament's going to be running right there. You might actually feel in between here, the joint line, you can actually feel the ligament and it may be very tender. You might also get a little medial meniscus action. So that's going to be the medial collateral ligament. And actually it's going to be hard to see, but we're going to have the same idea here on the lateral side. So we're going to have the lateral knee. There we go. We're going to have the lateral femoral condyle, and it's dropping down here to the fibular head. So you're going to have a tight band of tissue. So again, that lateral femoral condyle coming down that fibular head. So right about in there, I just realized I'm not even showing it. There it is. That's going to be the lateral collateral ligament. Now, if you do figure 4 them, it's going to be hard for me to see, but in the figure 4 position, you actually can come right here. You can really feel the tissue right there in this position if you put them in figure 4. Obviously, if they are symptomatic and pathological, they probably don't want to be put in that position, but for our purposes, we can do that. So again, quadriceps, patellar tendon, medial, and lateral collaterals.